So joining us now is Dr. Mark Kerouac, President and CEO of Bay State Health. He and his team have been working hard to provide the most accurate and up-to-date information about COVID-19 in our region. Dr. Kerouac is an experienced physician trained in internal medicine and infectious diseases. Good morning, Dr. Kerouac, and thank you for taking time out of your morning for us.
Good morning, Mike, and thanks for having me.
So, Dr. Kerouac, we'll start here by asking you, what is COVID-19 and how did it originate?
Well, it is a respiratory virus. Belief is that it started in an animal, that it started in bats, believe it or not, in the Wuhan area of China, and it made the jump from animals to man. And unlike many of the viruses that do that jump, this one was particularly good at spreading person to person, and it went from there all around the world.
Yeah, so next, Dr. Kerouac, please describe the symptoms of this virus and how it impacts our body.
Well, the great majority of people will experience a really kind of bad flu with cough and fever, chills and aches, stuffy, runny nose. A small percentage of people, maybe 20% or so, will be sick enough that they need to be in the hospital because their lungs start filling up with inflammatory fluid. And maybe 5% of people will even need to be in an intensive care unit. There are a percentage of people who really just get kind of a mild cold or almost no symptoms at all.
Dr. Kerouac, why are elderly and those with compromised immune systems at such a high risk?
Well, it's a good question, Mike. The why is not exactly known. We just know that it is a fact that in any given population, there are certain older folks, more frail individuals who seem to be less able to fight off this infection and seem to be more likely to get something quite severe, and they're at definitely increased risk of dying. So people with chronic heart and lung disease, with diabetes, etc., smokers, all seem to be at higher risk of having that more severe side of the spectrum.
Okay, thank you, Dr. Kerouac. So some people with symptoms are told to stay home. When should they seek a test, and what happens after someone gets a positive test result?
Yeah, I think what we've been, because the numbers of tests have been limited up until now, we've advised people to first call your healthcare provider, your doctor, call an urgent care center, whatever, to get advice about whether you should come in to be tested. Most people who simply have the milder version, we're telling them to simply stay at home, to sort of hunker down, to wait until they've at least 7 days have gone by and at least 3 days without any symptoms of cough or fever or whatever. It's only those people who look like they might need to come into the hospital or who might be at risk to expose other people, like a first responder or a healthcare worker, that we would urge to come in and get tested. We're hoping to expand that in the next few weeks so that even people with the milder illness can know for sure.
So, Dr. Kerouac, of course, you touched on caring for patients in hospitals. So there's been some confusion about this. Do all COVID-19 patients require hospitalization?
No, just about 20% or so.
Yeah, so just about 20%, obviously.
And I would say that based on our experience of treating nearly 400 of these patients now, about 70% or more are able to go home. And so the recovery rate is a lot higher than what you would be led to believe by, watching various internet sites, etc.
Yeah, and we had the video. We saw, of course, workers there at Bay State applauding as patients were leaving Bay State Medical Center with the Rocky theme song. That was a great video.
Yeah, we call it a Code Rocky, and it's gone viral across the state and across the country, I'm told. But it really not only was a big lift for the patients, but also for the healthcare workers who like to see the success of their efforts.
Yeah, that's for sure. I know our viewers really enjoyed that. Moving on to our next question for you, Dr. Kerouac. So what is the protocol after someone who has recovered from COVID-19? So how long should they remain in quarantine?
Well, if indeed you're sick with COVID-19, you should stay out at least 7 days and then also at least 3 days with no symptoms at all.
And so once someone has COVID-19 and has recovered, can they get it again?
Well, I think we're not entirely sure, based on our experience with other coronaviruses and the way this looks in terms of how it's behaved in other countries. It seems that once folks recover, they are protected and immune, at least for some period of time. There have been a couple of reports from South Korea that maybe people get it again, but I think that's a little early to say. The great majority of people seem to be immune once they recover. We're not sure how long that immunity lasts, if it's for a lifetime or for many years, but that remains to be seen.
And so during this COVID-19 pandemic, of course, there's a lot of concerns for healthcare workers on the front lines. So we've been getting a lot of calls and emails from employees at health facilities like hospitals, nursing homes, clinics. So what is the CDC protocol for health workers?
Well, for anyone taking care of a known COVID-19 positive patient, you need a mask, eye protection, gown, and gloves. And you need to be trained in how to take it, put it on and take it off without contaminating yourself. There's been some conversation about the kind of mask for special procedures that might generate aerosols. The CDC recommends a so-called N95 mask that would, and which is a tighter fitting and more filtering kind of mask. So that's the current recommendations. At Bay State, we've just recently decided to go beyond that and actually are asking folks on all of our folks who care for COVID patients, regardless of where they are in the health system, to wear the N95 mask in caring for those patients, and people wear the regular mask throughout the health system.